Our goal is always to help our clients feel empowered, to feel like they have some control over their lives and the path that they want to take. Hi, I'm Jess. I'm the clinical director here at Launch Centers. Oftentimes when we think about mental health or mental health treatment, we think about clients who are completely not functioning at all, when in all reality, a lot of our clients are incredibly high functioning. But in another area, maybe they're still really depressed or anxious or really struggling with a mental health issue or an addiction. And so it's really important that those things get addressed as well. Some people, I think, are really hesitant to receive treatment for mental health. They're a little bit scared of what that might look like, maybe feel like, oh, I'm not severe enough, this isn't that big of a deal. They might kind of dismiss what they're going through. But the reality is seeking help for mental health can be such an empowering decision in your life. Depression and anxiety are very treatable diagnoses. So I hope that people feel comfortable in seeking treatment for those things, knowing that there are options, there are things that can certainly help them. Depression is something that is incredibly common and impacts a lot of people. Some of the warning signs to look out for are isolating, not spending time with loved ones, not enjoying things that you at one point in time really did enjoy. One of the most evidence-based treatment for depression is called cognitive behavioral therapy, and it's something that we provide here at Launch, and it's incredible. I've seen it change lives over the years, and it really is such an amazing modality that really helps people to understand how their thoughts are connected to how they feel, how their actions and their behaviors are connected to how they feel. And it just gives a really amazing framework and understanding of what are things you can do each and every day, and simple things to help you lift your mood and feel better about yourself. We know that anxiety rates are going up, so having meaningful treatment for anxiety is more important now than it's ever been before. It's difficult to focus, it's difficult to sleep. They might find that it's difficult to do, kind of routine daily tasks because the anxiety is so high. They might have things like panic attacks. They might have various things that come up that are really sort of detrimental to their everyday life.
I always say the first thing that I always use when I am meeting with a new client who is struggling with depression or anxiety is just to validate their experiences. I think a lot of times people don't feel seen or heard in this world, and so that and just having empathy and providing them with unconditional positive regard is the best first approach, and then also equipping them with coping skills.
Anxiety can be incredibly treatable as well. So one of the things we do at Launch is we're really big on providing tools and skills for people so that when they are feeling anxious, how to keep the anxiety from escalating up. Bipolar is a diagnosis where people experience incredibly high, what we call manic mood swings, and then people also experience incredibly low lows. Treatments like cognitive behavioral therapy are incredibly helpful for when people were experiencing that really low period of depression. And then mania, it's about teaching them ways how to navigate that mania so that they're not doing impulsive things, that they're not doing things that are reckless that could be harmful for their life, and helping them sort of manage those mood swings a little bit more. So it's typically through a mixture of wonderful evidence-based treatment and also medication management. Schizoaffective and thought disorders can be incredibly challenging for people to navigate and to deal with in their life. This happens when people experience both auditory or visual hallucinations. They might have delusions about something that they believe to be there but isn't actually there, and so it can be incredibly frightening for the person that's going through that experience.
What a thought disorder is when someone's inner reality doesn't match up with the external reality. Validating that is their reality, I think, is how thought disorders can be treated, is not denying what they're hearing or believing or thinking about themselves or others. It is true for them. So we continue to reality test and try to move away from delusional thinking or disordered or paranoid thoughts, while also at the same time not judging or shaming or making clients feel embarrassed, because if they feel like it's something they have to keep on the inside, they will keep it on the inside.
I think that oftentimes people might get scared of what therapy looks like, of what treatment looks like, and the reality is it's just a conversation. As therapists, we're trained to be very, non-judgmental, to really hear people out and to listen to where people are at, exactly where they're at. So clients often report hey, I was nervous about coming, but yet at the same time, this actually turned out to be a way more positive experience than I was expecting it to be. coming to treatment is not something that is an easy thing to do. And so we want each of our clients to truly feel proud of the work they've done. We want them to feel proud of the fact that they've been able to address these really difficult emotional things and that they've been able to work through them in a meaningful way, hopefully create a sense of community, be leaving knowing that they're a part of our launch family.